Hello. So I'm coming back to you today with a live broadcast on narcissism. Okay? Just let's start with some visual from the internet. Right, so narcissism, if you do a search on Google, you'll get a lot of visuals, but let me show you what the narcissism images gives as a result. I structured this video with an introduction, then I'll tell you what is narcissism. I will talk to you about Freud as a precursor of concept of narcissism. I will then show the characteristics of a narcissistic personality. We'll talk about theories, effects of a narcissist on family, individual and friends, and on society. And then we'll give a brief overview of the treatments. Okay? So be patient, stay with me, and we will have a clear overlook of this. Right. So let's look at some images first. Let's pick this one, and you see here a man and a mirror, but what he sees in the mirror is not what he looks like. Here, another mirror, kissing the image in the mirror. More. Look, this one is very it's self-explaining. You see, this person looks in the mirror, but what he sees in the mirror is not as he's like, but he sees himself grandiose, like in this case, like a king. Okay, so people who enhance their selfies, people who are focused extremely or exclusively on themselves. Look, this picture, for example, here you have Obama and says, let's talk about my book to the children, or I love me. But this is not self-love, okay? This is a distorted perception of yourself, okay? Actually, the narcissist has a diminished view of himself or herself, but it projects a much better vision. Okay, let's look at this picture. This is narcissist. What happens? The term narcissism derives from the Greek myth of Narcissus. You see here Narcissus looking at his reflection in the pond, in the lake, right? But as soon as his picture, right, he falls in love with the picture. So he falls in love with himself. This love is so powerful that he is drained to the water and he dies into the water, attracted by his own reflection. So Sigmund Freud, this psychologist, doctor of the 1800s, he is considered the father of what is called the psychoanalysis, okay? Was the first to use this myth to illustrate the psychological condition of narcissism. Okay, this disorder therefore, is named from the mythological figure of Narcissus, who fell in love with his own reflection. According to Sigmund Freud, narcissism is a normal stage in child development, so the love for yourself. But it is considered a disorder when it occurs after puberty. So you may say now, so if I love myself, I'm a narcissist and I have a psychological disorder. No. The psychiatric recognition by the American Psychiatric Association came only in 1980 with the introduction of the diagnostic category of the narcissistic personality disorder, short NPD, in their diagnostic manual. Now, why narcissistic personality disorder is a mental condition? It is when it's characterized by an inflated sense of self-importance. So a person thinks of himself or herself as too important, the grandiose importance. A deep need for excessive attention, so a look for excessive attention and admiration, is in a troubled relationship, has a lack of empathy for others. But behind this mask of extreme confidence lies a fragile self-esteem that's vulnerable to the slightest criticism. We can then describe the narcissist as an arrogant, self-centered, manipulative and demanding person who may also be convinced that they deserve special treatment. People who think that they deserve special treatment. These characteristics typically begin in early adulthood and must be consistently evident in multiple contexts, such as at work and in relationships. Because they believe they are unique or gifted in some way, people with NPD often try to associate with other people who can enhance their own self-esteem. They are looking for constant admiration and attention and have difficulty tolerating criticism or defeat. So, the precursor of a concept of narcissism is this Sigmund Freud. In his work on narcissism in 1914, Sigmund Freud introduced the concept of narcissism as an adoration of ourselves as object of sexual desire. So, the narcissist chooses himself or herself as the object of sexual desire. Freud classified narcissism as a type of neurosis. According to Freud, there are two types of narcissism, primary and secondary narcissism. Primary narcissism, Freud speculates, is a type of inborn energy evident in young kids. As the child grows, though, this primary narcissism is directed outwards. So the libido, the sexual energy, is not directed toward the I, but outwards, toward objects which are objects of desire, not material objects, which are outside the I. We are in presence of the secondary narcissism when the individuals turn the affection for objects and people back on themselves. As a result, the individual becomes cut off from society and disinterested in others. The low self-esteem typical of a narcissist is due to their inability to express love to others and have it expressed back to them, and such a person is tormented by shame, guilt, and is often very defensive. Quote, the libido, so the sexual energy, the love energy that has been withdrawn from the external world is redirected toward the ego. hence the narcissistic personality. Let's see more in detail some characteristics. I will make some names, don't mind them, just to show that there are people, scholars, doctors, and psychiatrists, therefore, that have studied this disorder. They've made theories, they've made descriptions, so I will say the names, but that's not what matters. First, let's say this. There is, it's a quote from Skådel. Skådel is a part of the DSM, so this organization that classifies all mental illness. There is a fair amount of literature suggesting that narcissism is a dimension varying amongst people and across disorders, not necessarily a disorder in and of itself. So, first statement that says that some form of narcissism is spread across different disorders, right? So it's difficult to restrict the disorder in itself. So this person is only a narcissist. But we'll see there is more to this. On the same line of thought, Gildersleeve in 2012 points out that although narcissism is a personality disorder that affects many people, it is not easy to diagnose for two main reasons. The first reason is that the number of disorders for which people visit mental health care complain about new psychotic or neurotic categories, and b. the patient with narcissistic traits do not respond well to the most used psychotherapeutic processes. Okay, because of this, it is important to stress that there is a distinction to be made between people with narcissistic tendencies and those who have narcissistic personality disorder. Let's say narcissism is a spectrum, okay? A spectrum that covers mild difficulties, mild disorders, to very severe. So, in this spectrum, okay, you have, let's say, the first part as a tendencies, but the second part as a severe personality disorder, and that's the part that creates the most impediments, and that's the part that needs treatment. Which are the traits of a narcissistic personality? The narcissistic, this is a quote from Alan Schwartz, okay? PhD. The narcissistic is not mentally ill, does not have a personality disorder, and is most interested in gaining power, money, and prestige. Too many narcissistics succeed in their pursuits. There is no need to worry about the self-esteem of the narcissist. They have an overabundance of it. Okay, this is on the following the first line, like say the narcissistic tendencies, the people who have these willing to gain power, money, and prestige, to be admired, like, and they succeed because of that, and they are they have a very high self-esteem. On the other hand, and this is important, narcissistic personality disorder is the diagnosis for someone with severe narcissism. The person must meet the medical criteria, so the DSM criteria. In the next paragraph, I will give a list of the most common traits affecting the person with NPD who must show a long-lasting pattern, which starts in the adolescence, causing a dysfunctional relationship of the individual with the society and the culture. And this pattern is shown, you can detect, you can see this pattern in the following areas. Cognition, so the way a person views or perceives self and others. We said that the narcissist is seeing himself as much higher, better, much grandiose than he is in reality, so affects the cognition. affective cognition also in relation how the narcissist perceives the other, who usually he thinks they are below, they are less, they are inferior. Affectivity, so the ability to express, to give and receive love. Interpersonal functioning and impulse control. The inflexibility of the patterns has a negative consequences on social, interpersonal and working situation. Therefore, it causes distress or impairment in many areas of the patient's life. Finally, it must be caused by substance, might not, okay? So these difficulties, these impairments, must not be caused by substance abuse or head injury. Alright, so let's see the most common traits found in people with NPD. First of all, a narcissist has an appetite for the attention of others that can never be satisfied and experience extreme feelings of jealousy. Narcissists, and we have said that, expect a special treatment. They exaggerate their achievements, talents, and importance. On the other hand, they are easily hurt. They are easily hurt and feel rejected equally easily. Their relationships are rarely helpful, as they have an ability to take advantage of others to achieve a goal. So they use other people to achieve their goals. They do not see other people as people, but as tools to achieve their goals. So they have no regrets or conscience. In fact, they cannot empathize or understand and share the feelings of others. They have an abundance of fantasies about their own intelligence, success, power, and appearance. And as they feel unique, they believe that only certain people can understand them. They don't like to be criticized and respond with anger to humiliation and shame. They seek praise and positive reinforcement from others, and they must desire the best. So, in fact, they are selfish, self-obsessed, arrogant, tough-minded, and lacking emotions, in synthesis. They will use others to achieve their goals and believe others are envious of them, or they are envious of others. Furthermore, they have contemptuous or haughty attitudes and behavior. Let's see now some theories. Some theories that try to explain narcissism. Okay? So see here before that, let's look at some visual again. See toxic relationship between a narcissist and an empath. Or you could see narcissism, you see. The reflection is always better than the person. The need to always reassure by looking in the mirror as better than they are. See, this is a modern version of narcissism. Actually, we will talk about Christopher Lasch in a moment. See, self-centered, constantly self-centered. So everything is about me and myself. Huh? Okay. Let's see this. Me, you see. Okay. So, let's talk now about some theories that trying to explain narcissism. We already have said about Freud. Freud's theory is that the child grows grows out of primary narcissism, okay, and so it directs his libido outwards. That's normally what happens in somebody who doesn't become a narcissist. Freud suggested that in certain cases, libidinal self-centeredness stems from the child's feeling that they cannot rely on their caretakers for love. So this is important. When a child starts developing this solid feeling that he cannot or she cannot rely on their caretakers, so their parents, their adoptive parents, the people who take care for love. In fact, these children, in order to stop depending on the whims of others and risk their rejection, that's another aspect, rejection, they avoid deep and lasting emotional investments with others and turn their love exclusively toward themselves. In 1967, Kernberg asserted that narcissism is a defense against the projection of oral rage that in turn stems from the narcissist's incapacity to depend on internalized good object. I know this is a bit complicated, but what is important is most narcissists have chronically cold parental figures who exhibit either indifference or covert but spitefully aggressive attitude toward their children. At the same time, the future narcissist is often found to possess some special talent or status within the family. This quality of specialness serves as a refuge. So, Kohut in 1971, another theorist, rejects the traditional Freudian and, we said, Kernbergian thesis that narcissistic self-investment results from a defensive withdrawal of object love attachment following a pattern of chronic parental coldness or vengeful spite. So, we will not go into this, but we say the most preeminent features of cult theories are low self-esteem, so narcissism is based on low self-esteem, tendency toward periodic hypochondriasis, and feeling of emptiness or deadness. There are other approaches and theories on narcissism, but we do not have the time. This is not the place to expound them all. I just give you some stimulus. Another interesting aspect of narcissism, it's what is called cultural narcissism. Okay, in relation to the impact that a narcissistic personality has on the society now, it is interesting to report here, although briefly, the point of view of Christopher Lasch. In 1979, Christopher Lasch wrote the book The Culture of Narcissism. He was a historian at the University of Rochester and in the United States. Mr. Lasch took the clinical term of narcissism and used it to diagnose a pathology that seemed to have spread to all corners of American life. The narcissist, driven by repressed rage and self-hatred, escapes into a grandiose self-conception, using other people as instrument of gratification. We have said that for the individual, right? The narcissist is fascinated with fame and celebrity. This is the important point in society. The fear of competition, the inability to suspend disbelief, the shallowness and transitory quality of personal relations, the horror of death. Okay, we have seen all these traits earlier on, but the book argues that our modern society has produced a culture in which the psychological pathology of narcissism has been normalized. So it's normal to be a pathological narcissist. He supports this argument with analysis of a wide range of cultural, artistic, and social phenomena in mid-century America, including political movements. Even the culture of self-development and therapy is based on a society responsible to mass produce an I, the I, ego, which is grandiose but vulnerable, a species of false self. Right. I know it's very, it's a summary, very, very short. It doesn't give, but what it is important is to say that society events, phenomena, are being characterized by narcissism. Just as an input, think about what happens on a social network. When you see the large amount of selfies about me on a social network, then you see that's normal. It's normal people doing that. People showing their private stuff, themselves, it's about themselves. They want to become famous for nothing. So narcissism, it's even more an interesting criteria to understand what's happening, although not exclusively from this point of view, from the point of view of Christopher Lasch. There is another aspect of narcissism which is called malignant narcissism. Malignant narcissism is a psychological syndrome comprising an extreme mix of narcissism, antisocial behavior, aggression, and sadism. Grandiose and always ready to raise hostility level, the malignant narcissist undermines family and organization in which they are involved, and they humanize the people with whom they associate. Now, let me give you a quick image. I will talk another time. Okay, perfect. I want to show you something. Like malignant narcissism, for example. Malignant narcissism. Well, we might not share this view, but that's to say, Barack Obama is a malignant narcissist who only experiences real human emotions when his will is thwarted. What is malignant narcissism? Let's see. Here, on the other hand, they also say Trump isn't. I don't know if you can see that. So basically, if you do a quick search on Google, you will, and you type in malignant narcissism, you will have all these visuals. For what I have to add here is a person with malignant narcissism has the potential to destroy families, communities, nations, and work environment. This condition reflects a hybrid of or blending of narcissistic and antisocial personality disorders. Psychologist Erich Fromm termed the disorder in 1964. Psychoanalyst Otto Kernberg later delineated the symptoms of the condition and presented it as an intermediate between narcissistic and antisocial personality disorder. Okay, let's see now the effects of a narcissist on the the individual, family, and friends, so in the interaction with others. The maladaptive coping mechanism can result in issues in the workplace or in school or unemployment. Patients with NPD may have short-lived romantic relationships, so they can't have a long-term relationship, as they constantly seek for something better, or when the lack of empathy becomes apparent to their partners. Patients with NPD may exhibit an unforgiving nature and showcase anger and aggression in such close relationships. This can also affect work relationships or any close group activities. So you see the effect, the main effect in a relationship is that they cannot last. They cannot have a deep relationship or a long-lasting relationship. In 2009, there was the Twenge and Campbell published The Narcissism Epidemic, a haunting diagnostic detailing a gradual but seismic shift in the nation's cultural norm toward self-admiration, socially understood. Although certainly not all the consequences of heightened self-esteem are negative, this cultural phenomenon was described as destructive to American society at an extreme, damaging the reciprocity that binds family, and communities, and encouraging divisive and antisocial short-term behaviors over long-term collective decision-making. Okay? So you see the effect on the society. Several people report that main difficulty in a relationship with a narcissist or with someone affected by NPD is their inability to listen or to understand something not related to themselves. Their needs or preference are not noticed by the narcissist. So the other person feels ignored, humiliated, and abused. Imagine what it is now to be raised by narcissistic parents. Children who have been raised by narcissistic parents develop a tendency to blame themselves. They believe that it is their fault if their parents don't love them. As their personality is obscured by the parents' sense of grandiosity, they feel invisible, which means they don't know who they really are. The fact they become used to neglect, rage, lack of empathy, and emotional games makes them choose these as a model for any relationship. They develop insecure attachment, do not trust people, and become incapable of emotional intimacy. It is common for these children to become narcissistic themselves. Treatment. The treatment for NPD depends on the level of severity, the level of impairment that this disorder can cause in an individual. No medication has been approved by the Food and Drug Administration to treat narcissistic personality disorder. Nevertheless, mood stabilizer can be prescribed in order to prevent self-harm when a person presents symptoms of impulsive anger or aggression, also in case of anxiety disorders and cognitive disorders. NPD can be treated with psychotherapy in the form of treatments that have been adapted from therapies for borderline personality disorder. An intervention of this type requires therapists who have specialized training. So, some type of psychotherapy, transference-focused psychotherapy, psychodynamic treatment that starts with a verbal treatment contract which emphasizes the relationship between client and clinician. Schema-focused therapy combines psychodynamic psychotherapy with cognitive behavioral therapy. Mentalization-based therapy is a psychodynamic treatment that helps individuals with NPD to accurately self-reflect and reflect on others' thoughts and feelings. Dialectical behavior therapy, a form of cognitive behavior therapy, focuses on mindfulness, emotional regulation, distress tolerance, and relationships skill. Metacognitive interpersonal therapy was specifically developed to treat NPD. It consists of two stages: stage setting and change promoting. Supportive psychotherapy combines psychodynamic and cognitive behavior treatment along with medication when appropriate. So, in conclusion, we have seen that narcissism is a tendency in our normal life, but also is a mental disorder. This can create difficulties in life for the narcissist and especially for the people surrounding him. The treatments are based on psychotherapy and with some exception when there are specific symptoms related to other disorder, like for example anxiety disorder, some medication is prescribed by a doctor. So I hope you know more about narcissism and you start to think about it as a way to discern difficulties in your life. Thank you for watching. Thank you very much. Goodbye.